Good morning, my name is Jesus Sanchez, Project Manager at CRIS Cancer. In this video we are going to explain what are the objectives of the CRIS Translational Physician Talent Program, what kind of candidate we are looking for, and some suggestions for the evaluation. CRIS is a private foundation which obtains its funds from more than 70,000 members, as well as companies and big donors. We use these funds to support relevant research projects and brilliant researchers. The objective of the Translational Physician Talent Call is to identify young physician researchers with translational research experience and the potential to become leaders in their fields. We believe that medical investigators with research experience can lead highly targeted translational projects to answer relevant questions in cancer research. In particular, the evaluation criteria we will consider are: excellence of the candidate. To evaluate this section, the documents that we will take into account are mainly the track record and, secondarily, the CV. In this section, our interest is focused on motivation, ambition, and potential of the candidates to bring significant changes in diagnosis, follow-up, and treatment of cancer. In assessing the candidate's potential and competence, an important point is to evaluate the contributions the candidate has made during his or her career. Please, we want evaluators to look beyond the number of publications and the impact factor of the journals. The impact of the candidacy also has a lot to do with the lines of research, patents, databases, protocols, technologies, outreach, dissemination activities, and so on. Please also keep in mind that many of the candidates are research physicians, and that generally the number of publications is more limited. However, many of them have made important clinical contributions beyond their publications during her or his career. And when considering publications more than the number, we are interested in considering the relevance in the field of the publications. Impact of the candidacy. This section is mainly evaluated with the project proposal document and the track record. For CRIS, it's very important that the projects provide a benefit for patients in the medium to short term. We want projects to solve important problems that answer relevant questions, but always with the patient in mind. But we also consider that this project has to be a before and after in the researcher's career, a key point, a launching moment. Implementation of the candidacy. This section will be evaluated through the project proposal, the budget, and the mentor CV. It is important that the institutions where the projects will be developed have the necessary capacity to host and support the project. If you do not know the center, we suggest you that you check the core units on the webpage of the corresponding center or review the institution's publications. As for the mentor, this should be a person who can support the candidate at critical moments of the project, provide guidance or support in conflict resolution. Or in the case of clinical candidates, it can be somebody with the capacity to ensure that the candidate has sufficient time in their day doing research rather than consulting. You will find a number of additional hints at the end of the guideline for evaluators document, but in general, always try to justify your scores. And when doing so, do it from a respectful, positive, and constructive point of view. If you have any doubts, you can write us to the following email. Thank you for helping us.